taking the incredible lessons we've learned from the Test and Trace Corps, making them permanent, having a permanent ability to reach people at the grassroots, encourage health, support people, educate people, get them to the health care they need. And the Pandemic Response Institute. The Pandemic Response Institute takes everything we've learned, helps us make sure there will never be the next pandemic, creating the solutions, creating the approaches to stop pandemics from ever happening to begin with, or if God forbid there is one, being able to deal with them in new and better ways. Okay, the Public Health Corps first. Look, we understood after the first weeks of the COVID crisis that so much of what we were dealing with was a question of public education, reaching people, answering their concerns and questions, getting them to the help they needed. And that only works when you're connecting directly with the people at the grassroots, and ideally with community members leading the way, with people from that same community talking to their neighbors. That takes something that requires a permanent feature, something that allows us to reach people constantly, not just when the crisis has already begun. Look, we had to create the Test and Trace Corps out of thin air, out of scratch. We had to create something. It's become the biggest and most effective in the country. I want to thank everyone at Health and Hospitals that led the way on this effort, working with the Department of Health. Thousands of lives saved by the Test and Trace Corps. And amazingly, Test and Trace just hit its millionth, 1 million tracing contacts. Well, we learned a lot from Test and Trace Corps. We learned a lot from our Vaccine for All Corps, the amazing work the vaccinators did. Again, that was put together from scratch. Look at what they've done. You're going to see the vaccination numbers today. They're outstanding. They're unbelievable. We're going to take the people who worked on Test and Trace, the people who worked on Vaccine for All. We're going to create a new permanent New York City Public Health Corps. This is truly revolutionary, but it's something you're going to be seeing more and more of. And love this logo. You'll be seeing people wearing these shirts who are part of this Public Health Corps, going out in the neighborhoods, going door to door, going to community meetings, educating people, preparing them for the world after COVID, because we need to do everything we can to get out of the COVID era. It's coming soon. We have the chance to get out of the COVID era, but then we have a lot of other public health challenges that we need to address. So Public Health Corps, particularly in connection with the amazing work we've done with NYC Care. Again, thanks to everyone at Health and Hospitals. NYC Care, guaranteed health care for all New Yorkers. This is something there's still a lot more ability to reach people with, to get people health insurance who don't have it, to get people connected to primary care medicine who don't have it. We guaranteed all New Yorkers health care. The Public Health Corps is going to be leading the way to get people connected who haven't been before, and that's going to make us resilient. One of the things we learned in this crisis is folks who had not had access to health care were very vulnerable. People who went years or decades without the health care they deserved were often the folks who were the victims of COVID the most. Getting people health care, getting it to them regularly, making sure everyone has it when they need it, that's how you turn things around. We're going to be employing thousands of New Yorkers in this effort from the communities most affected by the challenges of COVID. And it's going to say something very clear, that in New York City, we believe before. I want to hear from two of the visionaries who have created, helping it come to life, and both of them in their life. The people. First, of course, I want you to hear from the city's doctor, and he has the great distinction of being the commissioner of the Department of Health. He also worked at Health and Hospitals before that, so he sees how we can bring all these strands together. He has helped to lead us, and he is helping to lead us out of the COVID era once and for all. Dr. Dave Choksi.
Thank you so much, sir. And you have said many times that we can't just bring things back to normal. Ours must be a just recovery, and bringing New York City back better means bringing our city back healthier. We have a once-in-a-generation opportunity to reimagine what public health can look like in New York City. The Public Health Corps will seize upon this moment, building on the hard work already being done in our communities to fight this pandemic and preparing against future emergencies as well. As COVID continues to shed light on health inequity, particularly inequity linked to structural racism, it is clear that the solution lies in the strength of our communities. We have seen this time and again during the pandemic, from Soundview to Sunset Park and from Port Richmond to Richmond Hill. The future of public health in our city must be led by the people who are most affected and who know the communities that they serve, often because they are from them. These community health workers, numbering over 500 by December, will be the backbone of the Public Health Corps, linking residents to clinical and social services. They will help more people get vaccinated, counsel neighbors about diabetes and depression, and address hunger and food insecurity. Also under the Public Health Corps umbrella will be about 100 community-based organizations, many of whom the city has worked with during COVID response, who will serve as the connective tissue for the Corps within neighborhoods. Additional work will happen at multiple levels, which can be summarized as care, confidence, and capacity. With respect to care, Corps resources will go to funding culturally and linguistically responsive care at federally qualified health centers, as well as H&H, as Dr. Long will outline. Building confidence starts by listening and acknowledging historically rooted distrust. It is also where one-on-one conversations can be the most meaningful, as we have seen in our vaccination campaign. The Corps will extend this work to other issues like flu, health screenings, and chronic diseases. Finally, in terms of capacity, the work that has been done through this pandemic offers us a veteran workforce with experience that should not be lost. We will build on this experience by working with CUNY, the Department of Small Business Services, and multiple community organizations to train community members, many already serving New Yorkers through the Vaccine for All Corps, to become community health workers. And the Health Department was recently awarded a $35 million grant from the CDC for such capacity building through the Public Health Corps. To conclude, Mr. Mayor, for most of the patients or community members that I've had the honor of knowing, they don't care so much about the distinction between epidemiology and care delivery. What they care about is staying healthy. Working across public health and healthcare, it is our job to make that happen. And it's why New York City, with the Health Department and H&H working side by side, is well equipped to integrate this important workforce. We're so excited to collaborate and create the foundation for a stronger, healthier, and more equitable city. Thank you, sir.
Thank you very much, Commissioner Choksi. And now I want you to hear from someone who, with his amazing team, thank you to everyone at Test and Trace. You've done an absolutely outstanding job. And remember, everyone, this had to be created from scratch. What an amazing effort, but they've had a dynamic leader, always energetic, and I know he is pumped up at the notion of taking what we learned and making it something permanent in this city. My great pleasure to introduce the director of the Test and Trace Corps, Dr. Ted Long.
Thank you, sir. Since June of 2020, our contact tracers have been fighting to keep our city safe against COVID. Our contact tracers are all New Yorkers that saw what COVID did to their communities. They heard the call to help, and they responded. Our contact tracers have been able to reach nearly 90% of all new COVID cases across New York City since they started in June of 2020. Furthermore, they've been able to identify more than 1 million close contacts or New Yorkers with a known direct exposure to somebody with COVID, and they've been able to engage 72% of those New Yorkers that have been exposed. Now, identifying 1 million close contacts is 1 million opportunities that they've created and used to connect New Yorkers to critical resources, like our free hotel program, where you can come to definitively isolate or quarantine to keep your family or your community safe, like our direct cash assistance program, which is unique to New York City to support families that don't qualify for paid sick leave, but the right thing to do is to stay home to keep their communities safe. Our tracers have also been able to connect New Yorkers to life-saving therapies like monoclonal antibodies, and to at-home testing and at-home vaccinations. Our tracers have succeeded in keeping our cities safe because they understand our communities, because they're from our communities. I'm excited to be here today to help to launch the new Public Health Corps, which will be an incredible way that we can leverage all of the skills and experiences that our contact tracers have built over the last year to become effective community health workers. Now, I'm a primary care doctor myself. I've seen my patients in the Bronx throughout COVID. What I want is to be able to care for my patients beyond the four walls of my office. With the new Public Health Corps, I will have community health workers on my primary care team by my side that can go to my patients' homes to help them to get food, to help them to get their medications, to help them navigate our healthcare system, and to help them to live a healthier life. Launching the Public Health Corps today truly makes New York City the public health capital in the country, if not the world. The Public Health Corps will build on everything that we've created through Test and Trace, with our community health workers being a backbone of this new program that will make New York City stronger and healthier than ever before. Thank you, sir.
Thank you so much, Ted, and your enthusiasm is infectious. Thank you. Now, I want you heard from the folks who are the architects here of this new Public Health Corps and what it's going to mean. I want you to get some perspective. And this is truly global perspective. The next person who's joining us has done amazing work. So first of all, her academic work alone speaks for itself. She's an associate professor in the Department of Global Health and Social Medicine at Harvard Medical School. But even more importantly, she's taken these ideas and put them into action, working with the organization Partners in Health, literally taking the concept of going out into communities to some of the toughest places in the world. She was one of the lead strategists in an effort to fight Ebola and strengthen healthcare systems in Sierra Leone and Liberia. So talk about a tough proving ground for these ideas. She's seen it, she's done it. It's my great pleasure to introduce the Chief Medical Officer of Partners in Health, Dr. Joya Mukherjee.
Thank you, Mayor de Blasio. I'm so honored to have been invited. Am I off mute? I just realized that. Oh, yeah. Okay.
There you go. You're good.
Thank you. Thank you, Mayor de Blasio. I'm so honored to have been invited to speak today at the launch of the New York City Public Health Job Corps. My remarks are made on behalf of my organization, an international medical organization devoted to partnering with communities and governments around the world to deliver health equity. Our organization has spent more than 30 years delivering high quality care in some of the most marginalized places in the world, as Mayor de Blasio noted. I have personally seen that health equity and indeed health justice is improved when community members serve as health workers, as navigators, as educators, to accompany the marginalized through their journey to better health. Public health jobs such as these are meaningful, are dignified, and are transformative to individuals who hold these jobs and to the community. Because of the long arc of American racism, there is disproportionate impoverishment, unemployment, lack of housing, and poor access to health care among Black and Brown communities. And Mayor de Blasio's investment in creating the New York City Public Health Job Corps will specifically impact those who suffer most from the root cause of ill health, which is economic injustice. For more than 20 years as Chief Medical Officer in Partners in Health, I have witnessed firsthand the transformative effects of community engagement in health work. Community health workers in Haiti have helped people living with HIV live long and meaningful lives. In Liberia, our community health nursing program has saved countless premature infants when they return home. In the Navajo Nation, community health representatives have transformed the lives of the elderly and the homebound. When COVID-19 hit my home state of Massachusetts, our governor asked us to leverage our international experience to create community health workforce in Massachusetts, which has also been successful at saving countless lives from COVID-19. As a physician working in more than a dozen countries and countless communities across the world, I count many of my friends as community health workers, and they have been my greatest teachers. By walking with and working with them, I have learned about the daily challenges of my patients, the barriers they face, and the support they need to be healthy. This great workforce has helped us at Partners in Health work with governments to build health systems from the ground up with the community, not only for the community. The disproportionate suffering and death of Black and brown communities from COVID must end. Community-based public health workers are a form of materially and morally meaningful job creation. And I'm confident that the New York City Public Health Corps will impact lives and livelihoods and deliver health equity. And I commend Mayor de Blasio's foresight in creating the New York City Public Health Jobs Corps.
Thank you so much, Doctor. I appreciate your energy, too. You've done amazing work all over the world, and the examples you gave really bring home the point. This can be a strategy that works everywhere and anywhere, but we got to focus on it and we got to invest in it. So thank you for helping to lead the way, and New York City is going to, I hope, provide an example to the whole nation that this is the future of healthcare. Thank you very much. Now, everyone, I want you to hear from the grassroots. You've heard like one of the great global experts give you the big picture. Now let's take it right down to the neighborhood level. I want you to hear from someone who worked with Test and Trace, did that work at the community level, engaging community folks, getting them to do what they needed to do to be safe. She's now working at health and hospitals, at Elmhurst Hospital, obviously someplace that was the center of the epicenter, and someplace where the work continues every day to reach people on a variety of healthcare needs. Here from the front line, I want you to hear from Maisa Alam.
Everyone.
Can you hear us, Maisa?
Yes, I can hear you. Thank you so much, Mayor, for giving me a chance to present today's press conference. I am Maisa Alam, a community health worker based at New York City Health and Hospital, Elmhurst, an area and hospital everyone know hardest hit by the pandemic. So prior to becoming a community health worker under the Public Health Corps, I worked as a community engagement specialist for Test and Trace Corps, making sure the city was reaching as many close contacts and potential COVID-19 positive cases to help stop the spread of the virus throughout the city. And now I am functioning to serve in another important support role within our public health system, making sure that New York have access and are connected critical healthcare services and support services that will help them to live a healthier life. And I'm from Jamaica, Queens. So as a Queens resident, I understand my community people and the patient I work closely with, helping them establish health goals and connecting them to various social services such as food, income, housing, immigration aid, and more other supported services that are available in our community. And also, I really, it's been fulfilling to see my patient and to see all those people to improve their health and start practicing their healthy lifestyle. And thanks goes to our weekly touch bases system. And I look forward to address the needs of those people infected by the virus and helping more New Yorkers create healthier life and more sustainable health practices. And I promise I playing my role, making sure New York have an overall healthier place to live throughout the public health corps. Thank you so much, everyone.
Thank you, Maisa. Thank you for the great work you've been doing. It is literally life-saving, and it's people like you that are helping to get us out of the COVID era and get to a better and healthier place. Thank you so much. All right, everyone. Now, I mentioned at the top another major new announcement today, and it's really exciting because, again, this is about the future. We never want to see another pandemic, but it's going to take a lot of work to protect New York City and protect the whole earth in the future. So today we're announcing something wonderful. Our Pandemic Response Institute, we've been talking about it for a long time. I'm happy to announce that we have selected Columbia University to operate the Pandemic Response Institute. This is a big step forward, and we've got the right people for this big responsibility. The city is going to invest initially $20 million in the Pandemic Response Institute to supercharge this effort. Columbia University, renowned all over the globe, is exactly the right place for it to be housed, and this will prepare us protect us against the potential of pandemics in the future, help us to stop the pandemics of the future, or worst case scenario, handle them in a way we've never been able to before. But at the same time, recognizing the real issues of inequity that have come up during COVID that need to be addressed. Columbia University's Mailman School of Public Health is renowned. It's one of the great public health schools in the entire country, a place that really focuses on the issues of equity and effectiveness simultaneously. They're going to be partnering with another great institution in the city, CUNY, the CUNY Graduate School of Public Health and Health Policy. Be right there with them as this institute is built into something powerful. We had a pandemic response lab. We put it together also from scratch to have the test results we needed to. It was one of many, many things we did in response to COVID. We created PPE, we created ventilators, we did things we never had to do before in New York City. But the initiative in the private sector, academic sector, hospitals, government, everyone got together. And here's the next big step, leading the global fight against pandemics that threaten us all. This is really powerful, and it's going to have national and global ramifications. And I want you to hear from someone who has been one of the great voices in this nation in how we fight infectious disease. Her career has spanned literally the nation, from her work in the University of California system to her leadership as the chief of infectious diseases department at the University of Kentucky. She is now the president of the Albert and Mary Lasker Foundation, one of the leading national voices on how we work together to address these challenges. My pleasure to introduce Dr. Claire Pomeroy.
Thank you, Mayor. As you have repeatedly highlighted for us, we are battling two pandemics, COVID-19 and racial injustice. And together, they have laid bare profound fault lines in our nation's healthcare system and lent new urgency to the call to better protect the health of the public. The creation of this Pandemic Response Institute is a powerful, proactive step forward in advancing health equity in our beautifully diverse city. The vision for the Institute includes exciting plans to protect New Yorkers, enhanced epidemiologic surveillance to identify patterns of virus spread, mechanisms to rapidly detect new pathogens, support for workforce development and capacity building, and innovative communications tools, all through the lens of racial justice and the need to address social determinants of health. The Institute will use a masterfully designed hub and spoke model with the hub located in Harlem and community observatories in each borough that will engage at the neighborhood level to make timely interventions. This whole of New York City approach ensures that the entirety of our city will be involved in the work to develop coordinated, culturally competent strategies to improve health. Under the guidance of Dr. Wafa El-Sadra and Dr. El Mohandes, along with an impressive array of academic, community, and industry partners, the Institute will bring together leaders with multiple perspectives, multiple expertises, and importantly, will empower the voices of members of affected communities, all with the goal of discovering novel approaches to fight both the COVID surges likely yet to come and the inevitability of future epidemics and public health crises. So I join in congratulating you, Mayor, the team at EDC and the Department of Health and Mental Hygiene, Columbia University, CUNY, and all the participating partners and community members for their dedication to this project. Thanks to the Pandemic Response Institute, we are better positioned to build a healthier, more resilient, and more just New York City, and to serve as a model for the world. Thank you.
Thank you so much, Doctor. I really appreciate the way you're bringing all the strands together and why this matters so much. And thank you for your leadership. It's people like you that have helped us to be able to create this model. Very, very much appreciated. And since you referenced your colleague, It's time for us to hear from her. She is the University Professor of Epidemiology and Medicine at Columbia University, Director of ICAP at Columbia as well, and the Columbia World Projects, and really has been one of the great national voices throughout the COVID epidemic on pandemic, I should say, on how we challenge this disease, how we do things differently, how we address this ever-changing situation. We've been so proud to hear her voice so often and learn from her, and now she will be leading the way by leading the Pandemic Response Institute. My pleasure to introduce Dr. Wafa El-Sadr.
Thank you very much, Mayor de Blasio, and very much appreciate the opportunity today to speak to you briefly about this wonderful initiative. As you said, Mayor de Blasio, this is a never again moment for our great city. Every New Yorker has experienced the terrible health tragedy that we have lived through for the past year and a half and that we continue to live through today. However, today, as we remember the lost lives, the social disruption, and the economic devastation brought by this pandemic, we are determined that this will never happen again. This groundbreaking initiative, the Pandemic Response Institute that you announced today, will bring together committed individuals and organizations to put in place a comprehensive framework to address our vulnerabilities and to take advantage of the many assets that distinguish our remarkable city in order to protect the people of New York and to prepare our city for tackling current and future health crises. We will do this by building on Columbia University's experience and expertise in addressing the toughest public health challenges around the world, and in collaboration with our key partner, the CUNY Graduate School of Public Health and Health Policy, as well as a wide range of community research and industry partners. Together, this team brings the knowledge, the skills, the partnerships to predict, detect, prevent, and lead recovery from health threats that we may face, that we are facing today, as well as that we may face in the future. As Dr. Pomeroy mentioned, through a hub-and-spoke approach, we aim to establish presence in all the 5 boroughs of our city, reaching our city's diverse communities with a focus on innovation, training and preparing a diverse workforce, engaging communities, and most importantly, with a focused determination to reducing the health disparities that you spoke about and Dr. Choksi spoke about as well, and that we all noted in a glaring light during this pandemic. And as is often the case, the initiative will put New York City at the forefront of what surely will be one of the most critical global health challenges. New York's Pandemic Response Institute will be a model for other cities across this country and around the world. So on behalf of everyone involved in this effort, I want to thank you, Mr. Mayor. I want to thank the New York City Economic Development Corporation and the Department of Health and Mental Hygiene for placing your trust in us. We are honored and we are humbled by this mission, and we are committed to making it a success. Thank you.
Thank you so much, Doctor. I appreciate deeply that commitment is coming through, and your leadership is going to make this come to life, and that means so much for the city and beyond. Thank you so much. I want to hear from one more person, everyone. He's been really one of the voices of conscience in this city throughout the pandemic. He has been someone who's looked at the next innovations and where we need to go, always looking ahead, and we appreciate that. He is the chair of the Health Committee in the City Council, Councilmember Mark Levine.
Good morning, Mr. Mayor. I am so thrilled to be part of this announcement and to be here with these esteemed health leaders, Dr. Pomeroy and Dr. El-Sadr. Thank you, Mr. Mayor. The truth is that we don't know when the next public health emergency will hit us, when the next pandemic will be, but we have to assume that there will be another pandemic. Much like extreme weather in this era, climate change itself and globalization and many other factors mean that what used to be once in a lifetime public health events, now we have to be ready for them to happen much more often. And we have to learn from our experience with COVID-19 to do everything we can to be fully prepared for the next crisis. And that means having the resources in place for testing and data collection and surveillance, really mobilizing the assets of IT and technology. And as you mentioned, Dr. Mayer, focusing on the challenge of inequality first and foremost, which to such a painful degree was laid bare over the last year and a half. And New York City is really uniquely positioned to lead in this effort, partly because of how hard we've been hit in this crisis, and also because we just have such strength in our biotech sector, in our life sciences sector, in our public health infrastructure. And so we are uniquely positioned to lead here. But the creation of this institute now is going to take that work to the next level. We'll formalize it in really important ways. And I had my fingers crossed, Mr. Mayor, that Columbia would win selection of this role, and I'm so thrilled about this announcement today. They are uniquely positioned, and Dr. Al-Sadr is an outstanding leader of this effort, and they've put together a really impressive consortium, which, as you know, includes our wonderful School of Public Health at CUNY, and they're going to both strengthen our infrastructure here in New York City, but also I think help us lead globally in preparing for a pandemic. So this is an exciting announcement, and I'm really honored to be part of this discussion, and I look forward to the work of this institute, as you said, Mr. Mayor, assuring that New York City is a global leader in public health preparedness. Thank you so much.
Thank you very much, Council Member, and thank you for your leadership. And I'm going to segue off of that to something else important. And Mark Levine's been one of the great voices out there also supporting something that's working right now, the Key to NYC, our mandate for indoor dining and fitness and entertainment. And entertainment, of course, includes sports. So I was on CNN this morning. I was asked about Kyrie Irving. I want to talk about this because it's really important for everyone to understand. Our home teams here, they'll be playing, the Knicks, the Nets. Obviously, they do fall under the Key to NYC requirement. And obviously, the vast majority of players are going out and getting vaccinated. We want all players vaccinated. So I'm a Brooklynite. I'm a Nets fan. I really want to see Kyrie get vaccinated. I want to see the whole team stay healthy and safe the whole season. We have a chance to win the championship for Brooklyn. It's staring us in the face. Let's go get it. It's an amazing, amazing team. Want everyone safe and healthy. It'll be a great moment for Brooklyn when they do win that championship. But let me just offer inspiration to any players who are still wondering, because some of the greatest players in the game today and in the history of the game are speaking up. So first of all, the MVP himself, Giannis, he said, and this is a quote, "I did what was best for me and my family to stay protected." That's why he got vaccinated. Amazing player, clutch player, Damian Lillard, said, "I've had people in my family actually die and people actually lose their lives to it. And if there's a way for me to protect myself and the people I love, I'm going to do it." That's why he got vaccinated. And literally one of the greatest of all time, New York City's own, and a graduate of Power Memorial, went on to one of the most amazing NBA careers in history, and an incredible voice of social conscience as well, Kareem Abdul-Jabbar. This is what he said: "This is a war that we're involved in. And masks and vaccine, they are the weapons that we use to fight this war." As always, Kareem pulls it all together. He's right. It is a war. It's a war we're going to win. We're going to win it because of vaccination. I also wanted to say we have a little breaking news related to this, and this is not about the NBA, but it's about the work to make sure everyone gets vaccinated. We just heard that YouTube is banning all vaccine misinformation videos, and I really want to thank them for that. We've seen horrible, cynical efforts at misinformation, often for people's own personal or political gain. YouTube's doing something really important here to make sure that they are not inadvertently agents of spreading misinformation and making people less healthy. That's the kind of gutsy move we need. We need people to step up, say the truth about vaccination, and help us move it forward. Also, on the vaccination front, this is exciting. One of the things I'm most excited about, one of the things I'm most hopeful about, is the vaccine for the 5 to 11-year-olds. So now Pfizer has formally submitted its data, and the FDA now has the opportunity to act. President Biden's been abundantly clear. Whatever the FDA needs, they will have every resource at their demand. I want to keep saying we need them to move quickly. We've said this a few days back. The goal should be have the vaccine ready by Halloween so we can start getting it to kids in the month of November. This can be done. We have so much evidence now. I know there has to be a thorough review, but we're pleading with the FDA, expedite this review so we can reach our youngest kids, keep them safe, have the whole school system able to get the vaccine for the safety of our kids and our families. Also, great news that we're seeing the FDA is reviewing now the Moderna booster. So hopefully that Moderna booster will be here very, very soon. And a reminder that right now, folks who can get the booster are those who received Pfizer shots originally. So if you got Pfizer shots and you are one of the eligible folks, you can go and get that booster. Go to vax4nyc.nyc.gov. We've been primarily focusing, of course, on health today, on public health, on the future of public health in this city. But I also want to always say public health and public safety go together. Next week, we're going to go over the latest on the situation in public safety in the city, the way we're fighting back against crime and violence, the amazing work of the NYPD and our community partners. But I want to show you just a quick slide that tells you something we're seeing more and more, that New York City's efforts to get guns off the street, to engage communities, to fight violence are having a big impact. A lot of other places are struggling. We're very sorry about that. We want everyone to move forward together, but New York City has now proven that our efforts are working. Our murder rate lower than the next 5 biggest cities, lower than the national average, and we're going to be doing a lot more. Every day we get a little bit more closer, a little closer to that recovery. Every day the recovery moves forward. It helps make us safer. But the public safety efforts also fuel the recovery. So we'll be talking about a lot about that in the next few days. And also related to public safety, obviously the ongoing work to improve the situation on Rikers Island for both our inmates and our officers. And the key is to reduce population now. That effort continues. Every day we're seeing reductions. That's really, really important. But again, the ultimate goal is close Rikers Island once and for all. That's what we've done in this administration. We got the vote for the city council. We put the money in the budget for the new community-based jails. We got to keep going. But what is good is the state has been working with us to make sure that we could get as many folks out of Rikers as possible the safe and appropriate way now. We continue to working on that. There's also a category that has been asked about several times. It's called 6A releases. These are folks with city sentences that I'm able to act on. We've done a review. And so far, as I've predicted, there are some people that we can release safely, appropriately, with the larger public safety in mind. We've done a careful review with the NYPD and district attorneys. But as I've said, it's a small number of people to begin with, and we're going to be careful and thoughtful about these releases. There are 7 individuals who will be released in the next 24 to 48 hours. We'll keep that process going. The much bigger piece is the hundreds and hundreds of individuals who are either going to be going to state facilities or being appropriately released via state action. That's how we're going to drive down the population, and we'll give regular updates on that. Okay, let's go to our indicators. And the first one, again, shows the power of vaccination and the amazing work of our Vaccine for All core. Number 1, doses administered to date, 11,455,785 doses, climbing. That is incredibly helpful. Number 2, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 123 patients, confirmed positivity level 24.06%. Hospitalization rate, this is the one, again, that's the most crucial statistic. We like what we see today. That number is 1.05 per 100,000. And then new reported cases on a 7-day average. Today's report, 1,221 cases. We like that number to continue to go down. The key is vaccination. Few words in Spanish, and this is about our public health core and what it's going to mean for the future in New York City. Nuestra misión es hacer de la ciudad de Nueva York la capital mundial de la salud pública. El equipo de salud pública y el Instituto de Respuesta a la Pandemia nos ayudarán a llegar a esa meta. Nosotros vamos a conectarlos a usted y a sus vecinos con la atención médica que necesita para mantenerse saludable y fuerte. With that, let's turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
Good morning. We will now begin our Q&A. As a reminder, we are joined today by Dr. Mitch Katz, Dr. Dave Chokshi, First Deputy Health Commissioner and Chief Equity Officer, Dr. Torian Easterling, Director of MOCJ, Marcus Soler, EDC President and CEO, Rachel Loeb. Our first question today goes to Juliet from 1010 Wins.
Oh, hi, everyone. Good morning, Mr. Mayor. How you doing?
Good, Juliet. How you been?
Okay, thank you. So since you were just talking about Rikers, I was wondering what you thought of the directive from the Manhattan DA who tells assistants not to request bail in nonviolent cases, but acknowledges that this might translate into additional low-level crime. What does that say to the law-abiding public that they aren't being protected?
Yeah, Juliet, I think I haven't seen the exact directive from the DA. I think this is always about striking a balance. I share your concern that it has to be very, very carefully approached. There are some low-level offenses where, again, I've said this for a long time, people do not belong in a jail setting. We can use supervised release. We can use a lot of other tools. And obviously, if we're having a particular challenge at Rikers, it's not the time to send someone there if there's not a reason. But when it particularly comes to anything involving violent crime or more serious crime, I would be very, very careful because we've come a long way improving the public safety situation, of course, this year, but we got more work to do. Go ahead, Juliet.
Okay, thank you. And regarding the new public health programs, to what extent are they working on preventive medicine, such as educating to prevent diabetes or heart disease? Are people eating better and in general taking better care of themselves?
Well, you hit the nail on the head. I'm going to turn to Dr. Long and Dr. Chokshi because the power of this kind of model, Juliet, is exactly that, educating people, moving them proactively. So much of the American healthcare system is, you only get seen when it's almost too late, or tragically, the first time someone sees a doctor is the emergency room. We're trying to change that. That's why we have guaranteed healthcare for all in this city. We want everyone to have insurance or have a primary doctor that they can afford through health and hospitals, NYC care. But the public health core goes to the people and demystifies and gets people to understand the things that will really help them. So that's my intro, quick illustrations from Dr. Long, then Dr. Chokshi.
Yeah, thanks for the question. I really appreciate that. Again, as a primary care doctor myself, preventive care is the backbone of primary care. The way it'll work is there will be community health workers on my team, and we'll take care of